Good evening and welcome to my presentation on quality improvement medication scanning. The person I interviewed was our director of nursing. She had over 10 years of experience, a master's in health administration, and she's daily involved in quality improvement processes within the organization. The project itself is improving inpatient and ED medication and scanning at the bedside. This was done for a couple of different quality improvement measures that the organization was reporting on, as well as looking at addressing some of the national patient safety goals, emphasis on decreasing medication errors. The aim of the project was increasing nursing compliance of medication scanning at the bedside, and it was important to decrease the risk of medication errors. These adverse events contribute to a decrease in patient safety, and so it's important. This has been a proven evidence-based practice to help decrease medication errors at the bedside by nurses. Who was involved? The whole team was involved. She talked about nursing, med staff, registration, compliance, quality, informatics, and pharmacy were two big partners. And then, of course, stakeholders. She talked about patients coming first as the main stakeholder in the process. The project was approved by our Quality Improvement Performance Improvement Committee. The process included education, daily review of scanning by the Director of Nursing, and daily huddle with the pharmacy regarding issues that were related to the Pyxis. The outcomes that were expected were 99% or better of medication scanning at bedside after 2 months of daily interventions. The data collection and analysis was a daily report developed to run at midnight, and the Director of Nursing would review the next morning and try to identify why nurses didn't scan at opportunities that they had to scan. There was a weekly team meeting to review these issues and kind of a brainstorming, problem-solving solution for steps taken to resolve some of these issues. So I asked her, how will you know that med scanning is better? And she talked about the baseline scanning rate was at 78%, and the goal is 99% or better. She also talked about she would know that adverse events would decrease, as well as reported medication errors would also decrease. So the overall patient safety was expected to increase. The barriers she expected to encounter and how she planned to resolve them were staff resistance. She wanted to provide more education, identify several champions of the project, repetition, continually going to the staff, trying to figure out why things weren't scanned, and then being very supportive of the staff when that happened, not blaming, but truly being inquisitive and curious as to what the causes of not scanning were. Some of the other problems were IT problems, informatics processes. Our electronic health record is a little clunky. She also talked about Pyxis errors, daily recognition of those errors, and teamwork with a pharmacy to resolve those. The impact on other departments were she talked about hopefully an increased accuracy of pharmacy loading medications correctly into Pyxis that had already been identified as a challenge. Informatics, improved electronic health record capabilities by billing these medications correctly into the charts. Our EHR is we're a small critical access hospital, so we have a limited ability to change the electronic health record. And so what we really needed to do, what was identified, was that we needed to build medication order sets that were actually part of the hospital formulary, instead of just allowing physicians to order anything that was in the system, whether we had it in our formulary or not. Providers were affected in needing to learn some new EHR pathways and order sets that were built, but they really did appreciate not needing to reorder something that wasn't available. The impact of the project was a stronger IT build with stronger informatics, stronger EHR, less system errors in the process. Um, Nurses and providers were much less frustrated with the Pyxis and EHR, or have been at this point. The progress, we're not quite over with the project, but um, so far we've noticed that the teamwork has actually increased. They seem to be treating each other with a little bit more respect and not blaming each other nearly as much, because they are also recognizing they're getting feedback onto what some of the reasons for the scanning rate was, and realizing it wasn't the nurses necessarily, it wasn't the providers necessarily, that there were some systemic issues that needed to be addressed. And the overall impact of the project was that patients were and have been much less likely to experience a medication error, so patient safety increased also. A collaborative team process was interesting to hear the director of nursing talking about the professionalism, critical indicators. The first thing that popped out of her mouth was patient first, patient first, patient first. What she looks for in professionalism is a nurse that's willing to advocate for the patient, and in all of their decision making is putting the patient first, but also respecting patient beliefs, values, and dignity, able to work in a team environment to provide care, treating others and teammates with respect, being very knowledgeable and competent in their skill areas, providing a high standard of care, being able to have critical thinking assessment skills, asking good questions, recognizing when something might not be the right thing to do for a patient, and being able to explain why they felt that way. Having attention to detail, being honest, having good integrity, and being able to work autonomously. Team building skills, you really focused on not making it personal, focusing on the issue, focusing on the problem, focusing on coming up with solutions, and also not taking a lone wolf approach. All team members should be included in decision making and be allowed to have a voice in how they feel a solution might work. Some of the barriers to the team, continued difficulties with the EHR errors each week, even after resolving ones that have been identified, having new ones come up. Non-compliance from nurses, there was some of that. Unusual medications needing to be added to the Pyxis without sufficient time to test. That was an interesting barrier. And then also an entire process needed to be developed regarding patients bringing their own medications while they were hospitalized, how to develop a process for scanning if the medication is not provided by the hospital pharmacy. There was nothing in place for that. And turns out that quite a bit of the medication scanning percentage was due to one of those last two barriers that were identified. Strategies used to overcome some of these challenges were re-education and one-on-one support when they needed for nursing and medical staff, encouraging the staff to reach out to multiple sources when a problem was encountered, continuing to work with quality and informatics and pharmacy to identify and develop solutions for the electronic health record problems. This was a favorite one of staff. They absolutely loved this. It came right around Christmas time. They were given additional PTO time. They were awarded those. Nurses were awarded additional PTO time who met 99% or better scanning. So that was really interesting to see the rate increase when that incentive was offered. There was a team weekly review of overall progress to compare if interventions were making a difference and to identify any new barriers to successful scanning. Strategies for effective teamwork or allowing respectful communication was the number one answer from the director of nursing, not allowing a blame game, recognizing that all team members were important contributors. All members were working towards the same goal, defining that goal for the group, and defining those boundaries of recognition and respectfulness in the process. Which allowed for respectful disagreement. It was part of the problem-solving process. It allowed members to say, I respectfully disagree, and this is why, and it kept it from becoming personal, which helped help get to livable and workable solutions quicker. Conflict negotiation methods, the director of nursing uses humor quite a bit, and she actually talked about that, using her humor in most situations. She maintains goal-focused, problem-focused, not person-focused, mutual respect, and encouraging open communication. Communication methods. She talked about using prearranged meetings and time frames, emails and phone calls, reaching out to individuals. People who became champions were those that were easiest to communicate with, that were responsive. They're mostly day shift nurses. The pharmacy and informatics, again, day staff. Others that were more difficult to connect with, worked less, PRN, night shift, didn't check their emails on a regular basis, or for some reason or another, didn't attend meetings. Those were the ones who were a little more difficult to communicate with, and also the ones who were a little more difficult to to get them on board with the project and the importance of it. Collaborative contributions for the team was using SBAR for a lot of communication between med staff and nurses and registration, but also encouraging each team member to respect each particular member's role and expertise, recognizing how each and every person can contribute in different distinct ways. All members work towards contributing to the team and having an attitude that no individual is more important than another, but all team members are important. Thank you very much. This has been my presentation on a quality improvement project for medication scanning at the bedside at my small critical access hospital. It's been a pleasure being part of this class and doing this assignment. Although I was part of that particular quality improvement process, it was interesting to hear the director of nursing's perspective on different aspects of the project. Thank you very much.